A heart attack can happen at any time, and when it strikes, time is the enemy. Every second counts, and access to world-class cardiac care may be the difference between life and death. That's why the Correll Cardiac Center's Cardiac Catheterization Lab now operates 24 hours a day, 365 days a year. But that would not have happened were it not for the Cath Lab's young director, Dr. Michael McDaniel.
Cath Lab has started to do a 24/7 program in the last year and a half. And we now are providing 24/7 STEMI care to the patients of Atlanta region.
STEMI is an ST elevation myocardial infarction. STEMI means that a patient's artery that's leading to their heart that brings the oxygen to the heart muscle is blocked.
We have patients here, they were coming in with heart attacks, but we didn't have an ability to take care of them all the time. So we would have to transfer these patients out of Grady to another hospital that would be equipped to open up the artery in a timely fashion.
Although he began practicing medicine less than a decade ago, Dr. McDaniel has already left his mark on the hospital. It was Dr. McDaniel who led an effort to create a STEMI program at Grady, putting in place a system to diagnose and treat the most critical heart attack patients in the shortest possible time.
If you start the clock at the minute that the ambulance pulls up to your house, that patient needs to be assessed by the paramedics, loaded into the ambulance, delivered to the hospital, brought up to the heart catheterization laboratory, in a stent placed across the blood vessel that's clogged up, and all that has to happen within 90 minutes.
Willie Wisdom credits Dr. McDaniel with saving his life after suffering a near-fatal STEMI heart attack last fall.
I had a massive heart attack, and Dr. McDaniel brought me back.
The STEMI team was successful in treating Willie that evening, and the following morning, Dr. McDaniel delivered the good news in person.
Dr. McDaniel is the first doctor ever that I've seen to come out and hug the wife and tell it's going to be all right. And he was there for me every single day he came to that room. He said, "Miss Wisdom, he's going to be good."
He said, I was a miracle man.
Without the STEMI program, Grady Hospital would not have been able to treat Willie in the small window of time needed to save his life. But even with the program in place, each success story begins with the unparalleled level of dedication and sacrifice put forth by Dr. McDaniel and his team every day.
The way they live their lives is on a hair trigger when they're on call. And when their beeper goes off, they literally go running out of a store if they're in a store, or jump out of bed, run to their car and dash to the hospital to save a life. Mike does that sometimes even twice a night, and the next day he has a smile on his face and he looks well rested despite having not slept at all.
We do have long days and sometimes long nights, but it's well worth it.
Dr. McDaniel is a collaborator and a leader not only in the hospital, but in the classroom where he works as an assistant professor of medicine at Emory University.
He shepherded an amazingly complex program from start to its opening over a year ago in a tremendously effective way.
I chose Grady because of the patients. The wonderful patients, and just it's a an honor to be here every day.
I say thank God for Dr. McDaniel. Thank God for Grady, because he gave me my husband back, because he was gone.